looking for Sophia.
Yeah, that's me.
All right, come on back with me.
Okay.
Hi Sophia, my name's Sarah.
Nice to
I'm going to
meet
be the
you.
nurse practitioner doing your exam today.
Okay.
I'm going to have you come take a step into my room here.
Sure.
Before you sit down, can I actually have you step on this scale over here for me?
Sure.
We'll get your weight real quick. All right, and Sophia, how tall are you?
5'3".
Okay, I was going to have you take a seat. All right, so I'm going to just start by going over some questions with you.
Okay.
I have your chart here, and I'm just going to note your height and weight. Sophia, can you tell me why you're here today?
I'm just getting a checkup today.
Okay. And how old are you?
I am 22.
Do you know what year it is?
It is 2023.
And what day of the week is it?
Today is Thursday.
All right. And what's your last name?
Delator.
All right. Awesome. I have those noted in your chart. Do you have any pain right now anywhere?
No, I do not.
Okay. Have you had any issues at home? Any complaints with vision? Trouble swallowing? Any like nasal drainage? Any issues?
No.
Any numbness, tingling in the hands? Any problems with sensation?
No.
Okay, sounds good. So first, I'm just going to start with like an inspection. So I'm just kind of looking you over. In general, you are well nourished, appear clean. Skin has a nice even tone. Just looking at your face, go ahead and look at me. I'm noticing nice equal facial symmetry. Ears equal, eyebrows equal, eyes equal, nice lash distribution. Lips are symmetrical. I don't notice any facial drooping. Don't notice any masses, lesions, any concerning moles or anything like that. So I'm just going to take a look at the scalp now. Just going to kind of feel your hair, just looking for texture, any moisture, dryness, any
I did just wash my hair, so it might be a little wet.
that's okay. Any lesions, any like scalp scars indicating any prior surgeries or anything like that. Just gonna look behind the ears. Awesome. And you haven't noticed any like hair loss more than normal?
No.
Okay, sounds good. So as we go through, I'm just gonna keep going with the face.
Okay.
So I'm just gonna kind of feel your skin here. Skin is nice, warm. I just feel all down. Noting muscle tone. Temperature is nice and warm. Skin is dry, clean. Same. I'm gonna keep going down with the legs. Noting muscle tone, warmth, equal bilaterally. Also, as I'm down here, I'm just taking a note for any edema, any lesions, any masses, anything like that that could be concerning on her assessment. I don't notice any edema on the lower extremities or the upper extremities, and I also don't note any abnormal lesions, masses, anything of that sort. I'm gonna come back up here. Now I'm just gonna palpate your sinuses, and I want you to tell me if you have any pressure or tenderness when I do this, okay?
Okay. No. Mm-mm.
No.
Nope.
Sounds good. I am going to pop out my handy dandy light pen. I'm gonna dim the lights and just take a look at your eyes, okay?
Okay.
Can you just note pupil size? And then I'm gonna have you just take a look at my pen and then focus, and I'm gonna bring it in. And I'm noting that her pupils constrict as I bring the pen in. So pupils are equal, round, reactive to light and accommodation, and her pupil size is about a 4. Okay, so now we're just gonna take a little bit more of an in-depth look at your eyes here. So just kind of like, I'm gonna pull down here, just looking at the sclera and your conjunctiva. The sclera is nice and white, and your conjunctiva is nice and pink. I'm going to shine kind of a bright light in your eye. If at any point it's too much for you, just let me know.
Yeah.
And I can back off, give you a minute's break. So first we're gonna look at the right eye, just noting the red reflex. And then as I bring this in, so noting the optic disc, it's a nice yellow-orange rim. We have good vasculature, no amount of veins, arteries throughout the eye. Also noting that the macula is a nice oval shape. And I'm going to have you go ahead and stare directly into my light, please.
Okay.
And you can unfocus there. I'm also noting the depth of your anterior chamber, which looks normal. Normal size is usually about 2 millimeters.
Okay.
And then we are going to take a look at the left eye here.
Sure.
So the same thing. We bring the light in,
Mm-hmm.
looking for the red reflex, and then I'm going to also take a nice close look. Alright, moving on to the left eye, and we are noting equal size shape as the right. Optic disc and macula are equal and the same as the right side. Vasculature looks the same. And go ahead and stare directly into my light, please.
Okay.
Perfect. Alright, so we'll step back from that. I am going to do a couple more eye tests with you. Okay?
Yeah.
So I'm going to have you just kind of take a look at my pen light and
Okay.
have you follow.
Okay.
With that assessment, I was also checking our cranial nerves 2, 3, 4, and 6. We're going to just take a look at your nose here.
Okay.
Just externally noting normal size, shape, symmetry. And just kind of shine a little bright light up there.
Mhm.
I don't notice any lesions, masses. The septum appears to be nice in midline. I don't note any nasal deviation. And we're also going to test cranial nerve 1, which is the olfactory. I'm going to have you go ahead and close your eyes.
Okay.
I'm going to have you smell something, and I'd like you to tell me what you're smelling, okay?
Okay. It smells like a pickle.
It's a pickle.
It smells good.
So as we move through the cranial nerves, what I'm going to have you do here
Mhm.
is I'm going to just kind of feel here, and I'm going to have you open and close your jaw.
Mhm.
And close. Open. Close. All right, awesome. So I'm assessing for any crepitus for the trigeminal nerve. Next, I'm going to be testing your facial cranial nerve. So what I want you to do is I want you to go ahead and look at me and give me a good smile. I want you to furrow your eyebrows, make a big, puff your cheeks out. Perfect.
That's fun.
And then we're going to move on to the acoustic cranial nerve number 8. Okay, so for this one, I will bring out my tuning forks. So what I'm going to do here is I'm going to hit this. It'll make a little vibration,
Okay.
and I'm going to have it on 2 spots on your ear, and I want you to tell me either the first or the second which one's louder.
Okay.
Okay?
The first one.
Okay, and we're going to do it again on the other side.
The first time. Again.
And then I'm also going to do this, place it on the top of your head, and I want you to tell me if the vibrations are felt equally on both sides.
Okay.
And heard equally on both sides, or if one side's greater than the other. Okay?
Yeah, I feel on both sides and hear on both sides.
Awesome. So, okay, so now we are going to take a look into your ears.
Okay.
Up and back. Just let me know if I'm hurting you at all. Alright, so we have a nice clean ear canal. I am
visualizing the tympanic membrane. It is a nice pearly gray, almost opaque color. I don't note any extra cerumen, any masses, lesions, or any abnormalities within the ear.
And then I'm going to move over to the other side. Sorry, just move your hair a little bit.
And the same on the left side. Ear canal is nice and clean, and our tympanic membrane is nice pearly gray, opaque in color, and looks symmetrical with our right side.
Okay, so while I'm back here, the next portion of this test is going to be a whisper test.
Okay.
So I'm going to have you cover one ear.
Okay.
I'm going to stand behind you and whisper a word, and I want you to tell me what it is.
Okay.
Okay?
Yeah. Start with this side?
Whatever side you'd like.
Yeah. House.
Okay, and then go ahead and switch ears for me.
Mm-hmm. Pick.
Sounds good. Okay, so now we're going to move on to your mouth.
Okay.
I'm going to have you just quick open.
Mhm.
I'm going to shine some lights. Just noting the soft and hard palate. Noting that no dental caries. She does have, it looks like a bottom retainer implanted. No missing teeth. You can go ahead and stick your tongue out.
Mhm.
And can you say ah for me? Awesome. So I'm noting a nice uvula rise, nice equal midline. While I have you have your tongue out, I'm gonna have you also move higher side, all around. Perfect. So we are also checking the glossopharyngeal and the hypoglossal cranial nerve, so that's 9 and 12. And then can I have you go ahead and swallow for me?
Mm-hmm.
All right, perfect. So I'm gonna have you do that again.
Okay.
But I'm going to feel for your thyroid.
Okay.
Look for the cricoid right underneath and go ahead and swallow. We have a nice normal rise with the thyroid on swallow. I don't note any increase with size, any masses, lesions, anything like that. But I will grab my stethoscope and we're gonna listen for some bruits.
Oh, I like your stethoscope.
Thank you. It's actually friends. So first we're going to start up here. Temporal artery. Now listen right above the eye. And then we are also going to listen for the carotid. Thyroid. I don't notice any bruise on assessment. So while we're here, I'm going to just palpate the lymph chains. So I'm going to have you kind of just turn your head a little bit to the left there for me.
Mm-hmm.
I'm going to start with the preauricular, postauricular, the occipital, submandibular, submental, and have you turn your neck a little more. The anterior deep chain, posterior deep chain, and supraclavicular, and sternocleidoid asteroid. Lymph nodes feel nice and soft. I don't notice any enlargement, any swelling, any asymmetry, any abnormalities with those. Did you have any pain or tenderness upon palpation?
No.
Okay, sounds good. I will kind of move back here real quick, check our last cranial nerve. I'm gonna place my hands on your shoulders and I'm gonna have you shrug up for me.
Mm-hmm.
Awesome, nice response. So now that we've completed the head assessment, I'm gonna move on down to your upper extremities.
Okay.
Already kind of felt for warmth, color. Like I said, don't feel any, skin is nice and dry, clean. I'm gonna take a look at the nail beds here. We have nice, clean, dry nail beds. Take a look at capillary refill. And she does have fake nails on, so we're using the underside of her hands to check. I'm gonna have you go ahead and give me a nice squeeze.
Mm-hmm.
Perfect. Just assess your pulses here. And we're noting nice equal strength with both the radial and brachial pulse on bilateral sides. Your carotid pulse. Same with the carotid, nice even pulses. So for the next portion of this, I'm going to have you flip your hand over for me. I'm going to write either a letter, a number in your hand, and I want you to tell me what I wrote, okay?
Okay.
So go ahead and close your eyes.
Okay. 3. Sorry, one more time. 4.
Yep. I have a little toothpick here. I'm
Okay.
gonna just place it on your hands. I want you to tell me if you feel a sensation.
Mm-hmm. Mm-hmm.
Next, what I'm gonna have you do is I'm gonna have you put your arms out like this.
Mm-hmm.
I'm gonna press down. I want you to lift up against me, okay?
Okay.
Go ahead.
Mm-hmm.
Put nice and strong, and then we're gonna flip and do the other way.
Push down. Yep.
Perfect, nice and strong. I'm gonna have you, we're gonna just check your range of motion. So we're gonna go
Okay.
up, down, out, and then can you cross, cross, and then up opposite shoulder and up opposite shoulder. Perfect. And have you just go ahead and rotate the wrists. Any pain or tenderness or anything like that when you're moving?
No.
Alright, sounds good. So we will move on to the lower extremities here. When I have her sit down, I will check her femoral pulse, but I'm going to, while we're sitting,
Mm-hmm.
check for popliteal. Nice and strong on both legs. We are checking the posterior tibial and the dorsalis pedis. We are nice and strong on each leg. I'm gonna go ahead and have you push on my hands
Mm-hmm.
and pull your toes up towards you. Good. And are you able to lift your knee out,
Mm-hmm.
bring it back in? Same with your other one. And can you bring your knee to the right side, all the way out, like your hip?
Oh.
There you go, and
Yep.
then back in. And then with your other leg,
Yep.
please. Perfect. Any pain, tenderness,
Nope.
discomfort, anything like that? Let me grab a hammer. We'll check our reflexes while we're down here.
Mm-hmm.
Come back up. Oh, gosh. While I have my hammer out,
Mm-hmm.
we'll do the reflexes on the upper arm. Now we're going to move on to the respiratory and cardiac assessment. So just sitting here noting you have nice unlabored breathing, I'm noting a symmetrical chest excursion. Don't notice any distress. Haven't had any audible wheezes or anything like that. So I am going to go ahead and take a listen to the front as well as the back side of you. So I'm going to just listen for the lungs here first. And take a nice deep breath in. We're going to do a nice deep breath in. Okay, and then I'm going to have you go ahead and spin to the side here just a little bit so I can listen to the back. Just from the front, I don't notice any wheezing, crackles, any abnormal lung sounds. All right, so we're going to do the same thing. I'm going to just kind of take a listen over the back. A nice deep breath in. We have nice equal lung sounds throughout the back. Again, don't note any wheezing, any crackles or adventitious lung sounds. So I'm going to place my hands here, and I want you to take a nice deep breath in. All right, we have a nice even expansion. Go ahead and spin around for me.
Okay.
While we're here, I'm just going to take a look at the trachea, noting it is midline in position, equal. And then I'm going to take a listen to your heart now.
Okay.
So I'm going to start with the diaphragm of my stethoscope. Just take a listen to the heart sounds, and then I will switch to the bell and listen for murmurs.
Okay.
So I'm going to start on the second intercostal space, right side of the sternal border. We are listening to the aortic. Second intercostal on the left side. They are pulmonic. Third intercostal is Erb's point. We have our fourth intercostal space. Left sternal border is our tricuspid. And then our fourth intercostal midclavicular line is our mitral valve. Okay. I'm going to switch to the bell and do the same thing. I'm going to try to lift up a little bit there. It's back over here. And listen to your apical pulse and get a heart rate.
nice normal heart rate.
About 80. I don't notice any murmurs on this patient. We have a normal S1, S2. I don't notice any extra cardiac sounds. So before I have you get up and move, while I have you just sitting here resting, I'm just gonna go ahead and count your respirations.
Okay.
Just nice, easy, breathe normal. Nice, normal, easy respirations. So I'm gonna have you go ahead and stand up now.
Okay.
And as I have you walk over to the exam table, I'm just gonna kind of take note of your gait. Have you had any problems with walking, unsteady balance, anything like that at home?
No.
Okay. So we are going to walk over to the exam table here.
Okay.
We're gonna come on over. And before you sit down, I want you to go ahead and close your eyes and have your arms right at your side.
Okay.
And this is going to be the Romberg test. And then I'm gonna have you go ahead and open your eyes.
Mm-hmm.
We're gonna turn to the side a little bit.
Mm-hmm.
Just noting her spine curvature. Don't notice any like kyphosis, lordosis, anything like that. I will have you go ahead and bend forward.
Mm-hmm.
Just feeling the spine, looking for any scoliosis. Checking the hip alignment, make sure we have nice equal leg length. We don't have any misshapen abnormalities, anything like that. So go ahead, and Sophie, we can go ahead and have us sit on the exam table here.
Okay.
And I'll have you take a little bit of a lay back and I'll bring you a pillow.
Okay.
So you can lay somewhat comfortably. Okay, perfect. Okay, so now that I have you seated, I'm gonna have you kind of just lay your head back a little bit.
Okay.
We are just looking for any jugular vein distension. I do note a little pulsation. Don't notice any strain, anything like that. Also just going to just take a look at the precordium here. Just looking, we see normal chest rise. I don't see any pulsations like that. So now I'm going to palpate here. Let me know if you have any pain, tenderness.
No.
Notice the sternum is nice and midline symmetrical. Palpating the chest for an apical impulse. I don't notice any frills, anything like that. And then I'm going to have you actually go ahead and lift your shirt a little bit for me. And I'm gonna have you lay back a little bit more.
Yeah. Is that okay?
It's perfect. Alright, so we're just gonna go ahead and take a look at the abdomen. I'm gonna first just inspect. Again, just looking at the abdomen, I'm noting nice equal rise with her breathing. I don't notice any abnormal masses, lesions, any open areas, anything like that. Oh, I'm sorry. That was funny. I heard that. Okay, we have very active bowel sounds. And while I have my stethoscope, I'm going to flip to my belt and I'm going to listen to the aortic, renal arteries, iliac arteries, and also your femoral artery. Start with the aortic. The renal, iliac, and femoral. Okay. Nice equal sounds bilaterally. I don't note any buries, and I will go ahead and feel for femoral pulse. We have nice, strong femoral pulses on each side. We're going to percuss over the abdomen, and then I'm going to palpate the abdomen. We're going to start here. Don't note any gastric bubble. I'm going to take a, we have some splenic dullness there. And as well as starting here, we're going to look for dullness over the liver, about there, and then we will make our way up, and again looking for dullness. Right there. I will measure that. And our liver is about 7 centimeters. So next I'm going to just do a light palpation. I'm just looking for any masses, any pain, tenderness, you just let me know, okay?
Yeah.
And umbilicus for any masses, hernia, any pain, tenderness.
No pain.
Next I'm gonna have you take a nice deep kind of breath in. I'm
Okay.
gonna feel here for the liver as well as the gallbladder. Huh?
Do you feel the gallbladder?
Well, I'm just saying that they're together.
Oh, okay.
They are together, right?
Yeah.
Okay.
I was like, I don't know if you can feel it though.
Yeah. Liver. And we will, I'm gonna move over to this side. Palpate the spleen. Go ahead, take a nice deep breath in. Probably.
My stomach's grumbling.
It's okay. And then with the palpation, I'm just noting any thrills, masses, lesions, anything like that. I don't notice anything. So I'm going to have you go ahead and kind of sit up, and while you sit up, I'm just going to
Okay.
look at your abdominal muscles, assessing for any hernias, normal musculature. And then I'm going to have you swing your legs over to this side a little bit. The other way.
Oh, okay.
Yep. Perfect. So while you're back here, we're gonna quick percuss the kidneys. You may feel a little discomfort. This is kind of
Okay.
but just let me know if you have any pain, tenderness, other than a little pressure there. Okay.
No. No pain.
Okay. Oh, excuse me. So while I'm back here, I'm also going to assess your tactile firmness. So I'm going to place my hands on your back, and then I'm going to have you say 99. Okay.
99. 99. 99. 99.
We note nice equal on each side. All right. So I'm going to have you actually go ahead and lay back down. I'm sorry.
Okay.
And while I have you laying down, I'm going to just kind of go from head to toe and just assess all of your joints,
Okay.
bones. I want you to just tell me if you have any pain or tenderness as I'm going down, okay?
Okay.
So we did most of your head. I am going to just do the mastoid process back here.
Yeah, no pain.
And the other mastoid. And your shoulder.
No. No.
About the elbow.
Nothing.
Wrist.
Mm-mm. No pain.
Don't notice any crepitus, any swelling, anything like that. I'm gonna flip your hand. I'm gonna have you close your eyes.
Okay.
I'm going to place my fingers on your hand, and I want you to tell me if there's 1 or 2.
Okay. 1, 2. 1, 1, 2. 1, 1.
Okay. And we're gonna do it on the
Yeah.
other side here. Eyes closed.
Yep. 1, 2. 1, 1, 2. 2, 1.
Perfect. As we keep going down, I'm just gonna feel your hips here. Any pain, tenderness?
No.
Don't note any crepitus. Look at the knees. And we'll move down to the ankles and the toes.
Nope.
Okay. I'm gonna take your socks
That's
off just
okay.
for a second. You can assess color and cap refill. I'm gonna just kind of take your ankle.
Mm-hmm.
Okay, go ahead and put your socks back. I got it. Thank you.
Okay. Okie dokie.
All right, so while you're sitting up, we're gonna just go ahead and check the ankle conus. I'm gonna just move your ankle here a little bit.
Mm-hmm. Mm-hmm.
Okay, and have you move your feet. And one more thing I'm gonna have you do, get that up there a little bit. Now have you go ahead and close your eyes.
Okay.
And I'm going to touch a part of your body, and I want you to tell me what side and where I'm touching.
Okay.
Okay?
My left arm. Right side of my face. My right leg. Both of my hands. The left side of my leg.
Good. Go ahead and open.
Mhm.
Okay, so one more test, and then we should be all finished up for our exam here.
Okay.
So I'm going to bring us up again, and I'm going to have you stand up here with me.
Okay.
And I have my handy dandy Snellen chart. So I'm going to stand a little far away from you, and can I have you, we'll turn a little this way.
Okay.
I'm going to have you cover one of your eyes and read this last line.
It doesn't matter. This one?
Yep.
Okay. L T F P H.
Go ahead and uncover and cover the other one.
Okay.
And go ahead and read that last line for me.
Okay. L T F P H.
Okay. And that is 20/20 vision. So we are good there. I do just want to note, as I'm doing the assessment, there's a lot of things that I was able to gain by not necessarily asking her. She was able to follow my commands and appropriately responded. Voice and tone was nice and even throughout this examination. She maintained normal eye contact, body posture, didn't notice any distress or signs of depression, anxiety, anger, any mood swings. Are you having any hallucinations?
No, I'm not.
Okay. But just over a general, assessment with looking at her, I can note normal skin tone, cleanliness, and a lot that I can get just from, everything that we've done through this examination. So, Sophia, do you have any questions for me, comments, concerns, anything that you would like to add?
I don't. Thank you.
All right. And thank you so much. Bye.